Everyone, it is Wednesday, the 22nd of April. This is Q&A with Dr. D. My name is 𝘿𝙧 𝘿𝙚. I'm with Performance Plus Physical Therapy, and this is my daily Q&A with Dr. D. Let's get Instagram set up here. Hope everyone is doing well. And today, we are continuing our conversation around hips, guys. And today's conversation is going to be talking about, can overpronation cause hip pain? How many guys, if you are tuning in, how many guys have heard about overpronation or knows what that means and what that can possibly have in terms of implications for the hip joint? Anyone? We got 2 people on live. How are you guys? It's Wednesday. Happy hump day. Any thoughts about this? I'm going to dive right in, okay? Hey guys, coming in on IG, drop a wave. How are you? Drop your questions in, guys that are listening. Okay, so let's talk about this. So the question of today is, can overpronation cause hip pain? To answer this question, we got to go back a little bit and we got to talk about what overpronation is. So overpronation is actually a condition that refers to the positioning of the foot. Okay, not the hip, but the foot. So it's a little bit of a complicated question. It's kind of like there's one part of the body can affect another part of the body. So when we talk about the foot, we talk about pronation describes basically a triplanar rotation or movement of the foot. So the foot goes up and down, and you can test this with your ankle as you hear. It goes up and down. It goes in and out, which we call abduction and adduction. Up and down is called convection and dorsiflexion. And then it does this rotational kind of thing on a rotational plane on the foot, okay? When you have a position where basically if you're standing flat on the floor and your arches collapse and you kind of shift your weight and roll in towards the inside of the foot, that is called pronation. The opposite, where you roll to the outside or the outside border of your foot, is called supination. When pronation happens, or in for this particular question, when overpronation happens, you have a consequential change in the alignment of the joints all the way up the chain, through the knees, and also through the hips. And it also actually has consequences even on your pelvis and on your lumbar spine. So if we're looking at this little model here, you can see the feet here. If there's pronation happening at the feet, guys, it's actually going to bring your knees in, or it's going to kind of go in towards each other, which is what we call knee valgus. And that can also consequently change the alignment of the hips, and that's the hip joint there. And that hip joint can also now come into a little bit of adduction or internal rotation also, if you're talking about the rotational plane. In response to the positioning of the feet. And you guys can test this out a little bit for yourself. Just stand up on the floor, and when you stand on the floor, let your feet collapse. And you're going to feel that there's a little bit of a change in your knees and also in your hips. And then vice versa, stand up nice and tall and shift your weight to put your weight more on the outside of your feet. And you're going to feel that your knees change position, which also means that your hips are going to be opening up and more externally rotated, and also what we call AD or abducted, okay? So to answer the question, indirectly, can overpronation cause hip pain? It is possible. I would not say that it may be the primary driver, because of course there are other things that are possibly going on if you have a lot of overpronation of your foot, but it can be a factor in causing hip pain. If the alignment of the hip joints, as I just showed you here, let me turn back on my iPad. If the alignment of the hip joint changes, then it also means the mechanics of the hip joint changes. Okay, I'm going to show you guys on Facebook also. Okay, so if that hip joint is not lined up in that ball and socket, and it's not lined up this way, but all of a sudden it's rotated that way, it's going to change the way that those muscles function around that joint, and that ability for that joint to move in all directions as it should. Showing you here on Facebook, let's pretend this is the ball and this is the socket of your hip. Okay, this hypothetically would be your right hip if I'm facing you. If that foot rolls in and it's pronated and that joint rolls in, it now internally rotates that hip joint and that changes how that joint moves around as you try to walk, as you try to stand, as you try to sit, and of course how those muscles around that pelvis starts really engaging. Okay, so because of those mechanics, guys, you can really get a really interesting chain reaction of a change in the mechanics of the joints, not only at the knees, but also at the hips, that can start causing pain because of overpronation. One common thing that does happen is something called hip bursitis. That's when the bursts are at the side of the hip, or the structures at the side of the hip that are responsible for decreasing friction as you walk, as you move your leg up and side, starts getting inflamed. Okay, so that's a very common consequence of having those hips in that internally rotated and kind of collapsed position. Okay, so that kind of sums up the answer for today. The question again for you guys that are now coming on is overpronation. Can overpronation cause hip pain? And the short answer is yes, it can contribute to hip pain. And that is because any change in the mechanics or the alignment of the bottom of the foot itself, can start translating all the way up the chain and bringing the knees in collapse, or what we call abduction, or if we're being specific at the knee valgus, and that starts consequently changing the mechanics all the way up at the top of the hip, and changing and getting it into a more adducted and internally rotated position, which changes how those muscles react and work around that joint. Okay. I see that you're on here. I wave that you drop a question in for me if you have any questions about hip pain. Thank you. I'm glad that you're enjoying this, and I'm going to check on Facebook. For those guys that are logged out on Facebook, do you have any questions about this or any other questions about hip pain? Talk to me. Let me know what you're thinking. Have you heard of overpronation before? Has that happened for you guys before? Have you guys seen someone or experienced overpronation yourselves? Or have you guys heard of people talking about this and how important it was in terms of changing your pain? Talk to me a little bit. Talk to me. Give me some hearts or give me some comments. Let me know what you're thinking. I'm going to check in Facebook. Facebook has no feedback from me, no comments, no questions. Well, I hope this was clear, guys, and I hope this was really helpful for you. Tomorrow, I'm going to be pushing forward and talking more, answering more questions about hip pain. On Friday, chances are I probably will be giving you guys some examples of exercises to do for hip pain that I think has been pretty successful and really helpful for people that are having hip pain get out of it. Again, of course, the reasons why you may be having hip pain can be varied, but there are lots of solutions that are on the table that may be beneficial for you. One of these may be. So I'll go through a couple of things and you'll give me some feedback and let me know if this is helpful for you. Okay. All right, guys. Hope you guys are doing well. It is the middle of the week. Let's keep pushing through. We got 2 more days to go before the weekend is here. The weekend is here. Hope you guys are staying on the schedule and staying safe and staying sane. And I will catch you guys tomorrow. Okay. Bye. Have a good day.